The Haiti Humanitarian Airbridge is a public-private partnership developed and managed by humanitarian logistics NGO Airlink. Financed by USAID, the Bureau of Humanitarian Assistance, and resourced by commercial aviation and logistics companies, the project was born out of serious logistics and transportation challenges faced by NGOs responding to rapidly growing cholera outbreaks in Haiti.
Our disaster teams in Haiti and Washington, D.C. realized the humanitarian community faced a logistics challenge to bring cholera treatment supplies to Haiti. We discovered there were multiple and similar requests for logistics assistance being made by humanitarian partners. To help streamline efforts, USA decided to establish, formalize, and fund the Haiti Humanitarian Airbridge in partnership with Airlink and other key logistics organizations. Thanks to these efforts, we were able to overcome supply chain disruptions and provide resources to local communities that help them in their fight against cholera.
As much as 75% of humanitarian funding is spent in the supply chain, from procurement and warehousing to transportation and customs clearance. Air transportation is often the most volatile and costly component of the supply chain. Air charter prices to Haiti have increased 160% in the last 6 years, with the offloading cost alone increasing 600% to more than $30,000. And air freight rates are at an all-time high. In the case of Haiti, the closure of seaports and restricted high-cost air transport options left NGOs without viable, affordable options to transport the supplies necessary to sustain this emergency response to the cholera outbreak.
There was a desperate need in Haiti, and those needs were largely unmet. The problems of transporting aid to Haiti were huge, and the world was distracted by Ukraine and other disasters. What was so frustrating about the situation in Haiti was that Global Medic had critical aid in the form of mobile field hospital tents to support the expansion of Partners in Health cholera treatment clinics. But what we didn't have was a way of getting those tents into Haiti that wasn't cost prohibitive or would mean that they'd arrive too late to prevent a pandemic. From an NGO's point of view, that's a heartbreaking scenario to face.
Food for the Poor was sending Manna Packs, a nutrient-rich food pack to help patients recover from cholera. But the need was growing, and what we were sending was often stuck in ports because of the closures as a result of gang violence across the island. This created a major challenge for us. We needed to continue to support the needs, and transporting heavy cargo via air transport was beyond our budget. This partnership was a game changer.
We knew from recent experiences that providing NGOs with predictable transportation through an air bridge would exponentially expand the amount of aid communities received as more and more NGOs became aware of its availability. But we also knew that to get it moving requires a dedicated core of partners working together and each bringing a unique set of resources and skills. Nothing about this program was easy. There were many, many moving parts. The UPS Foundation supported trucking services to Miami for cargo originating in the US. American Airlines leveraged existing space on their Paris and Dublin to Miami routes to move medicines and medical supplies procured in Europe. In addition to donating their logistics services, Seco Logistics provided a consolidation warehouse for the first flight.
Logistics is the untold story of any disaster response. It's not aid if you can't get it there. As a logistics business, we know we have the resources to help move aid, but we need to know we are sending the right aid to the right places and that it can be distributed. We don't want just to send stuff. That is counterproductive. Partnership is critical for any business wanting to help in disaster response. We had been heavily involved in trucking and moving aid to Ukraine through Airlink and their NGO partner network. So we knew that this partnership had the ability to make a real and meaningful impact.
It was the American Airlines cargo team that identified unused cargo space in the belly of passenger planes traveling from Dublin and Paris to Miami, filling the empty space with essential medical supplies and cholera medicine only manufactured in Europe to the people of Haiti. Based on recent and past collaborations, we knew that with the partnership of Airlink and their NGO network, USAID and BHA, the UPS Foundation, plus other private sector actors, we would be doing the right thing and that we would be making a difference in the lives of thousands.
The Haiti Humanitarian Airbridge provided the aid community with access to fast, free transportation, and that saved countless lives. 10 aid agencies benefit from this multi-country, multi-partner airbridge, which helped deliver 232 tons of aid across 29 shipments through 5 charter flights. Over 137,000 people gained access to water, sanitation, and hygiene services and supplies, including point-of-use water filtration devices and community-wide filtration systems. And nearly 45,000 people received treatment for cholera through IV fluids, testing, fortified meals, and medications. 100% of the NGOs assisted would otherwise have been unable to deliver supplies at the scale required for successful response. It was a true public-private partnership that made the impossible possible.